But I live in Southern California, and whenever we have a fire, you have the helicopters dumping bromide, fire retardant on those fires, and then I'm breathing it in, and I'm sitting here trying to eat my organic food and do all the right things, but I can't control that.
Yeah, think about it. So that's one way. Think about the brominated hot tubs, the brominated pools.
Yeah.
It was bromine, brominated flour. It's in the 1960s and before that, the flour was all iodinated. It was iodine's used as a conditioning agent to make it soft. And in the early 1970s, right when radioactive iodine use became in vogue in medicine, it shifted from iodinated flour to brominated flour. It's unclear. I can't find an article. I can't find someone saying we should do this, but it was done. And that has accelerated. That's what really accelerated the iodine deficiency epidemic. And, then, like you said, when they're dumping it from the skies, when they're putting it in our water, they're putting it in our pools and our hot tubs, much less our food supply and all our consumer goods. And, the carpet that your feet are on right now, the mattress or the cushion in your chair that your rear end's sitting on right now probably has bromine in it. Your blinds and your curtains and your windows have bromine in it. We can't get away from it. And so therefore, I think that's what's drove down our iodine levels and raised our toxicity levels, and is in large part this whole conflation of things causing the epidemic of breast cancer, ovarian cancer, uterine cancer, thyroid, prostate, pancreas, all those problems.
And not just the cancers, just unexplained weight gain and fatigue and being tired and water retention and hair loss. I'm hearing so many people, men and women, saying, I can't believe it. My hair is just falling out. And it begs the question, with the increased radiation, the increase of the spike protein that we know is affecting the thyroid, with the increase of the GMOs, the glyphosate, the heavy metals, the fluoride and bromide, and then you talked about iodized salt. Well, 36 out of 39 salts tested in a salt study were full of microplastics. So here you are taking salt to try to get some iodine, but you're filling your body with microplastics, another toxin. So we have all of these things hitting us. It begs the question, is there anyone who doesn't need to be supplementing with iodine today?
I'm never a fan of saying everybody needs this. And, but in our modern world and where we are with things, I don't know if everybody needs it, but most people do. And look, as a population level, iodine levels have fallen 50%. Toxic halides have gone up through the roof. Cancer has gone up through the roof.